Hancock.
Mr. Speaker, with permission, I'd like to make a statement on coronavirus. We're approaching the end of a year where we've asked so much of the British people. And in response to this unprecedented threat to lives and to livelihoods, the British people have well and truly risen to the challenge by coming together to slow the spread and support each other. I know how difficult this has been, especially for those areas that have been in restrictions for so long. The national measures have successfully turned the curve and begun to ease pressure on the NHS. Cases are down by 19% from a week ago, and daily hospital admissions have fallen 7% in the last week. January and February are always difficult months for the NHS, so it is vital we safeguard the gains we've made. We must protect our NHS this winter. We've invested in expanded capacity, not just in the Nightingales, but in hospitals across the land. And we've welcomed thousands of new staff. Mr. Speaker, this morning's figures show the number of nurses in the NHS is up 14,800 compared to just a year ago. Well on our way to delivering on our manifesto commitment of 50,000 more nurses. Together, while we invest in our NHS, we must also protect our NHS. So it'll always be there for all of us during this pandemic and beyond. Mr. Speaker, I'm so grateful for the resolve that people have shown throughout the crisis. Thanks to this shared sacrifice, we've been able to announce that we will not be renewing our national restrictions in England. And we've been able to announce UK-wide arrangements for Christmas, allowing friends and loved ones to reunite and form a 5-day Christmas bubble. And I know that this news provides hope for so many. But we must remain vigilant. There are still today 16,570 people in hospital with coronavirus across the UK, and 696 deaths were reported yesterday. That means 696 more families mourning the loss of a loved one, and the house mourns with them. So as tempting as it may be, we cannot simply flick a switch and try to return life straight back to normal. Because if we did this, we would undo the hard work of so many and see the NHS overwhelmed with all that that would entail. We must keep suppressing the virus while supporting education, the economy, and of course the NHS until a vaccine can make us safe. That is our plan. We will do this by returning to a tiered approach, applying the toughest measures to the parts of the country where cases and pressure on the NHS are highest, and allowing greater freedom in areas where prevalence is lower. While the strategy remains the same, the current epidemiological evidence and clinical advice shows that we must make the tiers tougher than they were before to protect the NHS through the winter and avert another national lockdown. So we've looked at each of the tiers afresh and strengthened them, as the Prime Minister set out on Monday. In Tier 1, if you can work from home, you should do so. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. And in Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaway. Mr. Speaker, I know that people want certainty about the rules they need to follow in their area. These decisions are not easy, but they are necessary. We've listened to local experts and been guided by the best public health advice, including from the Joint Biosecurity Centre. We set out the criteria in the COVID-19 winter plan, and we published the data on which the decisions are made. As the winter plan sets out, the 5 indicators are the case rate in all age groups, in particular cases amongst the over 60s, the rate at which cases are rising or falling, the positivity rate, and the pressures on the local NHS. When setting the boundaries for these tiers, we've looked not just at geographical areas, but the human geographies which influence how the virus spreads, like travel patterns and the epidemiological situation in neighbouring areas. While all 3 tiers are less stringent than the national lockdown that we're all living in now, to keep people safe and to keep the gains that are being made, More areas than before will be in the top 2 tiers. This is necessary to protect our NHS and keep the virus under control. Turning to the tiers specifically, the lowest case rates are in Cornwall, the Isle of Wight, and the Isles of Scilly, which will go into tier 1. In all 3 areas, they've had very low case rates throughout, and I want to thank residents for being so vigilant during the whole pandemic. I know that many other areas would want to be in tier 1. I understand that. My own constituency of West Suffolk has the lowest case rate for over 60s in the whole country. And I want to thank Matthew Hicks and John Griffiths, the leaders of Suffolk and West Suffolk councils, and their teams for this achievement. But despite this, and despite the fact Suffolk overall has the lowest case rate outside of Cornwall and the Isle of Wight, our judgment, looking at all of the indicators and based on the public health advice, is that Suffolk needs to be in tier 2 to get the virus further under control. Now, I hope that Suffolk and so many other parts of the country can get to tier 1 soon, and the more people stick to the rules, the quicker that will happen. We must make the right judgments guided by the science. The majority of England will be in tier 2, but in a significant number of areas, I'm afraid, they need to be in tier 3 to bring case rates down. Now, I know how tough this is, both for areas that have been in restrictions for a long time, like Leicester and Greater Manchester, and also for areas where cases have risen sharply recently, like Bristol, the West Midlands, and Kent. The full allocations have been published this morning and laid as a written ministerial statement just before this statement began. I understand the impact that these measures will have, but they are necessary given the scale of the threat that we face. We'll review the measures in a fortnight and keep them regularly under review after that. I want to thank everybody who's in the tier 3 areas for the sacrifices that they're making, not just to protect themselves and their families, but their whole community. And regardless of your tier, I ask everyone, we must all think of our own responsibilities to keep the virus under control. We should see these restrictions not as a boundary to push, but as a limit on what the public health advice says we can safely do in any area. But frankly, the less any one person passes on the disease, the faster we can get this disease under control together. And that is on all of us. Mr. Speaker, we must all play our part while we work so hard to deliver the new technologies that will help us get out of this, in particular, vaccines and testing. The past fortnight has been illuminated by news of encouraging clinical trials for vaccines, first from Pfizer-BioNTech and then Moderna, and then, of course, earlier this week from the Oxford-AstraZeneca team. If these vaccines are approved, the NHS stands ready to roll them out as soon as safely possible. Alongside vaccines, we've made huge strides in the deployment of testing. Our rollout of community testing has been successful because it means we can identify more people who have the virus but don't have symptoms and help them isolate, breaking the connections that the virus needs to spread. As part of our COVID-19 winter plan, we'll use these tests on a regular basis, for instance, to allow visitors safely to see loved ones in care homes, to protect our frontline NHS and social care colleagues, and to allow vital industries and public services to keep running safely. Mr. Speaker, we've seen in Liverpool, where now over 300,000 people have been tested, how successful this community testing can be. And I want to pay tribute to the people of Liverpool, both for following the restrictions and for embracing community testing. It's been a big team effort across the whole city, and the result is that in the Liverpool city region, the number of cases has fallen by more than 2/3. In the borough of Liverpool itself, where the mass testing took place, cases have fallen by 3/4. It hasn't been easy, and sadly, many people in Liverpool have lost their lives to COVID. But thanks to people sticking to the rules and to the huge effort of community testing, Liverpool's cases are now low enough for the whole city region to go into tier 2. This shows what we can do when we work together. We can beat the virus. And I want to pay tribute to the people of Liverpool, to NHS Test and Trace, the university, the hospital trust, and Mayor Joe Anderson, and so many others who've demonstrated such impressive leadership, responsibility, and a true sense of public service. We're now expanding this community testing programme even further to launch a major community testing programme honing in on the areas with the greatest rate of infection. This programme is open to all local authorities in Tier 3 areas in the first instance and offers help to get out of the toughest restrictions as fast as possible. We'll work with local authorities on a plan to get tests where they're needed most and how we can get as many people as possible to come forward and get certainty about their condition. The more people who get tested, the quicker a local area can move down through the tiers and get life closer to normal. Mr. Speaker, viruses can take a short time to spread, but a long time to vanquish. And sadly, there is no quick fix. They call upon our determination to make sacrifices that will bring it to heel, and our ingenuity to make scientific advances that will get us through. Hope is on the horizon, but we still have further to go. So we must all dig deep. The end is in sight. We mustn't give up now. We must follow these new rules and make sure that our actions today will save lives in future and help get our country through this. And I commend this statement to the House.
The Secretary of State, Jonathan Ashworth.
Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement? And I suppose we should all thank him for advance sight of the website, but sadly it crashed before we could check what tiers we were in. Now, the news of the vaccine is indeed light at the end of the tunnel, but we are still in the tunnel, and we have a significant way to go to drive infection rates down and keep our constituents safe. Now, we understand why tough restrictions are still needed. But let's be clear, today, millions of people trying to survive in the second lockdown will soon be forced to endure further local lockdown restrictions. So does he accept that these interventions succeed when made in tandem with local communities? Because I remember when areas like Bury and Trafford went into lockdowns in the summer, the Secretary of State promised that MPs would be involved in the decision. Has that commitment now been abandoned? Then ministers agreed to involve regional leaders, but took exception to being challenged by Andy Burnham. So what role do regional leaders now have in these decisions? Or is it really the position that the Prime Minister imposes from Downing Street restrictions on communities across the Midlands and the North, restrictions that will have a huge impact on the livelihoods of families and small businesses? Christmas, he will know, is vital for pubs, for restaurants, for entertainment venues across these areas. They will need substantial financial support to get through this period. And will those areas that went into Tier 3 lockdowns before the national lockdown, like Greater Manchester, South Yorkshire, now get backdated economic support for their local small businesses? There are now parts of the country, like my own city, Leicester, like Bury, like Lee, like Haywood, that have been under a form of lockdown for months and months and months, where families have been forced apart, where grandparents haven't seen their grandchildren. Those families tonight will want to know what the exit strategy is and what voice they will have in that strategy. Now, he has outlined 5 criteria by which local lockdowns will be judged. Will he publish clear, transparent rules for areas entering and leaving tiers, a scorecard, if you like, for every area, assessing their COVID progress against their criteria so everyone can judge it publicly? Now, he talks of mass lateral flow testing, which we welcome the advances. But over 2 weeks ago, he announced he was sending, I think, 930,000 of these tests to local authorities, yet only around 8,500 are currently being used a day. Could he explain why that is? He will also be aware, I'm sure he studied it, that Slovakia recently tested over 3 million people over a weekend using these tests. They incentivise people to get tested by offering greater freedoms. Is that part of the government's thinking for how these tests could be used? Now, evidence from Liverpool suggests that there is a lower penetration of take-up of these tests in poorer, harder to reach communities. See, isn't the problem, Mr. Speaker, that if people and their contacts feel they will be financially penalised for a positive test, that they will avoid a test, they'll switch off the app, they won't answer their phone to unrecognised call centre numbers. And the reason people just soldier on when ill isn't because of stiff upper lip. it's because they can't afford to feed their families otherwise. So surely, after months and months, it is now obvious that people, low-paid people, like care workers on zero-hours contracts, need better support to isolate. So why didn't the Chancellor increase statutory sick pay in the spending review yesterday? The test and trace budget has now increased to £22 billion. That's more than the annual budget for the police and the fire service combined. Yet the OBR yesterday confirmed that their forecasts are based on the fact that, quote, a less effective test, trace and isolate system necessitates keeping a more stringent set of public health restrictions in place over the winter. So at what point will he accept that the current model, that the Serco model, has failed? I'm not against using the private sector, but I am against throwing shed loads of taxpayers' money at failing private sector contracts, Mr. Speaker. Local authorities, especially those now in Tier 3, should be leading this retrospective contact tracing work, and they should be given the data from day one so they can get on with it. And by the way, Mr. Speaker, why was there no uplift yesterday in the public health grant? Surely this is a time when we should be investing in public health, not freezing the grant. Now, on the easements for Christmas, there will indeed be relief from families across the country, but he will understand that there will also be nervousness across the NHS. We need a clear public health message. Asking people to be jolly careful is not good enough. He will know that January is an immensely busy and pressured time for our NHS. It's not just the patients filling up COVID beds. It's the emergency pathways, which are already running at hot. It's the immense elective backlog. We know there are less beds because of social distancing. We know staff are exhausted. 1 in 7 hospitals have restricted electives or planned operations so far this winter. So what plans are in place to protect the NHS through January, especially if there is a long, cold winter snap? How many elective operations does he anticipate will be cancelled in January? Now, nobody in this House wants to see a third lockdown. So can he guarantee that the measures he has announced today will be enough to bring the R down and sustain it below 1 for the coming months until a vaccine allows life to return to normal?
Thank you very much, Mr. Speaker. The goal of the government is to bring R to below 1 to suppress the virus until a vaccine can keep us safe. That is the strategy, taking the precise points that the honourable gentleman raised. He asked for an exit strategy. The statement I outlined is the exit strategy. It is to keep this virus suppressed with the minimum damage possible to the economy and indeed to education, whilst we work as fast and as hard as we can towards a vaccine and the use of community testing widespread across the piece to help to keep the virus under control. I would have expected him, Mr. Speaker, to have welcomed the massive progress in Liverpool that has shown that a combination of sticking by the rules and community testing at very large scale can help to bring this virus right under control. Instead, he criticised that it doesn't get into harder to reach communities. That is exactly where we need to get into, and that's why we do it in combination and hand in hand with the local authority. And I praised Joe Anderson. I'd also praise other local leaders, Ben Houchin in the Tees Valley, who's working with us on this, Andy Street and leaders across the West Midlands, Dan Jarvis in South Yorkshire, who we're working with to get a community testing system up and running in places like Doncaster. I want to see this community testing, which has been successful in Liverpool, rolled out right across the Tier 3 areas as much as is possible. And I invite all councils to engage. We engaged with councils and invited them to engage ahead of the decisions today. And we also invited all colleagues from around the House to put their input in. But it is important that we have clear public health messaging, because unfortunately we did see the impact on the number of cases going up and continuing to go up in those areas where local leaders were not working alongside us. And it was a sharp contrast to what happened, for instance, in Liverpool, but also in other areas where the local leadership were so constructive and positive. He asked for a scorecard in terms of the exit strategy. I think that's a good idea. We published this data. If we can make it into an even more accessible format, I think that is a good idea. He asked about supporting the NHS. Absolutely. And I'm delighted that yesterday, my right honourable friend, the Chancellor of the Exchequer, with the support of the Prime Minister, put another £3 billion into the NHS on top of the £6.6 billion that's already being invested. And that money starts flowing this financial year for this winter and then runs into next year. He also mentioned the need to support people who've tested positive. We've put in place a £500 support payment. And on test and trace, NHS test and trace, Mr. Speaker, I thought from the figures this morning, he would have welcomed the fact that the majority of in-person tests are now turned around within 24 hours. Really significant progress on the speed of turnaround in testing, for which I am very grateful to my team. There will be further support for local councils that find themselves in tiers 3 and 2 to support the action that is needed. But all in all, Mr. Speaker, let us come together and work together to get this virus under control, keep it under control, so that we can get life back to normal as soon as possible.
Jeremy Hunt, Chair of the...
Thank you, Mr. Speaker. Can I welcome the Prime Minister back from his splendid isolation to the place he has no doubt been itching to get back to more than any other, this House of Commons, and say how wonderful it is to see him here. And thank you, Madam Deputy Speaker. I think from a sedentary position, the Prime Minister said he was delighted to see me here. These are very difficult decisions, and indeed delighted to see me here on the back benches. These turning to more serious matters, Madam Deputy Speaker, these are very difficult decisions, and part of the leadership you have to show in a pandemic is telling people unwelcome news. And I want to salute the Health Secretary's cautious approach to Christmas, because much as we all want Christmas to be as normal as possible, nothing would be more crazy than to take our feet off the accelerator at this moment and then see a spike in deaths in February. And so I think this is the right approach. There is one bit of further good news on top of the news about vaccines, on top of the news about mass testing, which I know he would like to be able to give and would be enormously welcome. And that is that every single person living in a care home could be sure that they could be visited by a close relative before Christmas. Now, I know he wants to do that, but there are huge logistical challenges in getting that mass testing technology to work in time. Could I just urge him to do everything he can, because that would make such a big difference to the nearly 400,000 people in care homes.
Madam Deputy Speaker, I hesitate to interrupt the love-in between the Prime Minister and my predecessor. But I'm grateful to his support. I'm grateful to their support. And this is a set of difficult measures, but I think the public understands why we have to take them and why they are necessary. On the point about getting visiting going in care homes, he's absolutely right. You know, sometimes we talk about these tests and this new technology in an abstract way or from a scientific point of view, but it really matters, and it really improves people's lives. And where we can use testing to make visiting safe in care homes, that is an example of the sort of thing that these new technologies can help to get life a little bit back towards normal. Of course, it's got to be done in a safe way, and of course, it's got to be done carefully. But we are now developing the protocols for exactly how that can happen, and working hard with the goal that everyone should have the opportunity to visit a loved one in a care home before Christmas.
And now we go to Dr. Philippa Whitford.
Thank you, Madam Deputy Speaker. Many scientists have expressed concern that the easing of restrictions at Christmas could lead to another surge of COVID cases in January. With cases still over 80% of the level at the start of lockdown, is the Secretary of State not worried that allowing outdoor events of 2,000 participants and indoor events of 1,000 in level 2 high-risk areas could actually drive up infection rates ahead of Christmas? While the lateral flow testing is very welcome in how it increases capacity, the Secretary of State previously stated the mass testing in Liverpool was a pilot and would be evaluated before being rolled out elsewhere. As the city has also been under tight restrictions and then lockdown, how will the impact of mass testing alone be evaluated? How does he plan to counter the lower uptake among deprived communities, the very ones at highest risk seen in Liverpool? And with no clinical evaluation yet published, how can he justify putting out contract tenders for an eye-watering £43 billion and rolling out this approach to 67 other areas? Should this strategy not be compared with investing money and energy in getting the traditional test, trace and isolate system working properly? Currently, over 40% of contacts in England are still not even informed they should be isolating. Finally, he knows it's not testing, but isolation which stops the spread of the virus. And if people who are infected or could be carriers are not isolating, no amount of testing will stop viral spread. The study by King's College, which suggested less than a quarter of people were isolating when advised, was incredibly worrying. So what assessment is the government doing to clarify current isolation rates and understand the reasons why people may not follow the advice they are given?
Thank you very much, Madam Deputy Speaker. Well, of course, we're constantly evaluating the impact of people isolating and how many people isolate when asked to. I would just encourage the Honourable Lady to look at a broader range of studies than just that one from King's College, and especially when you look at the self-isolation of those who test positive, which does tend to be higher. She asked about the use of these lateral flow tests to have a negative impact on the number of cases in an area. Of course, we've been evaluating this all the way through the study in Liverpool, and that's why we can have confidence in rolling it out more broadly across Tier 3 areas. I included in my statement a high-level assessment of this, which is that if you look at Liverpool city region, the number of cases is down by 2/3, but in the city itself, where the testing took place, it took place of people who live in the city and of people who work in the city and live largely in the wider city region. The number of cases is down by over 3/4. Now, that's one piece of evidence. It is clear that it's the combination of people following the rules and the community testing put together with the appropriate incentives to get people to take up the mass community testing. That is what can help to make this work. And we want to work with local directors of public health to understand and to know how this can work effectively in their areas, precisely to reach the hard to reach that she mentioned. Finally, I would echo, Madam Deputy Speaker, the request from the Honourable Lady that we be cautious this Christmas. But I would say to her that having agreed an approach across the whole UK, including with the SNP government in administration in Edinburgh and with the Welsh Labour administration and the cross-party administration in Northern Ireland, I'm delighted that there is an approach all the way across the UK, because there are so many ties that bind us together, which mean that we are stronger as one united kingdom working together to tackle this virus.
Greg Smith.
Thank you, Madam Deputy Speaker. It's incredibly disappointing news that Buckinghamshire, having entered the national lockdown in Tier 1, will emerge from the national lockdown into the more punitive restrictions of Tier 2, a decision that will be hard to understand in the rural communities of North Buckinghamshire that have relatively low infection rates, and a decision hard to understand given that there has been zero consultation between central government, Buckinghamshire Council and our local NHS. Appreciating that my right honourable friend has impossible choices to make to control this virus, will he commit to ensuring that Buckinghamshire Council and our local NHS is fully consulted as these tiers are reviewed going forward?
Well, yes, of course. Along with my honourable friend, the Director of Public Health in Buckinghamshire was invited to engage with the team as we were looking at the indicators and making this decision. These are difficult decisions. He's absolutely right about that. The case rate in Buckinghamshire is 138 per 100,000, and positivity is above 5%. We'll be reviewing these allocations in a fortnight and then regularly thereafter. And I look forward to working with my honourable friend and supporting the people of Buckinghamshire to do what is right and to get these case rates down and to get Buckinghamshire, if at all possible, if it is safe, into Tier 1 with the lighter restrictions. But it is critical to keep people safe that we take the action that we need to today.
Munira Wilson.
Thank you, Madam Deputy Speaker. A recent UCL study found that with the previous tier system, less than half the public understood what the rules were for the tiers. So today we have a new tier system. We have a 5-day relaxation at Christmas. We have a government website that's just crashed this morning. The written ministerial statement that's been published this morning has got a number of question marks against different areas. There have been inconsistencies regarding timing between what the Prime Minister has said, what the OBR has said, and what the Secretary of State has told MPs in terms of length of restrictions. So I have a very simple request. Will the Secretary of State please ensure there is a very clear, consistent and honest communications campaign to ensure public trust, compliance, and so that we don't overly raise expectations?
Yes, there'll be a very widespread public information campaign about these new tiers because it's on all of us to follow the rules in our local area and out with the rules. You know, notwithstanding the rules, make sure that all of us, we all need to behave in a responsible way because we all have a role in controlling the spread of the virus.
Now we go to York, to Julian Sturdy.
Thank you, Madam Deputy Speaker. As the government continues to impose further unprecedented restrictions on people's freedoms, it's important to give people hope and justification. So as York's COVID rate continues to fall and is the lowest in Yorkshire, can the Secretary of State outline how we can get to Tier 1 baseline as fast as possible? And will he publish the assessment and the data under which York was placed into Tier 2 so we can best judge how to get to Tier 1? And when he talks about regular reviews, can I say a weekly review, Secretary of State, would be much more desirable?
Yes, I can answer positively on all counts. We have a regular weekly session to go through all of these. I say regular rather than, I'm committing to regular reviews rather than weekly, simply because sometimes we have to do it more than weekly, especially if you see the cases shooting up in an area. On the point about publication, absolutely. We've published today not just the data, and we'll publish more data on each area, but also an explanation in each area for the reason for the decision that was taken. I know that he and colleagues across York have worked hard because there was quite a serious spike in York that is coming down at the moment. But overall, we still require the whole of North Yorkshire to go into Tier 2 because the case rates are still elevated right across North Yorkshire, and we all need to work together to get them down.
Ruth Cadbury.
Thank you, Madam Deputy Speaker. And I share my neighbouring colleague, the Honourable Member for Twickenham's concern about clarity over tiers and messages. But one message and one rule that is clear but is unwelcome is the 11 p.m. curfew for pubs and restaurants. Curfews fail to address the issue of crowds in the streets and on public transport, which have a risk of spreading infection. So will he commit to meeting with London government, including the Mayor of London, as soon as possible to discuss this and agree the criteria London needs to meet to de-escalate as soon as possible?
Well, of course, we've been engaging with the team who've worked across London. There is a lot of work to do in London. There are parts of London where the cases continue to rise, and we need to get that under control. But there are also parts where they are falling, and things are very much going in the right direction. Likewise, there's pressure in some parts of the NHS, but there's a lot of mutual aid within the NHS right across London. So there's a lot of work to do in London to keep it in tier 2. And I look forward to working with her and other London colleagues on that.
Dr. Ben Spencer.
Thank you, Madam Deputy Speaker. People living in Runnymede and Weybridge often ask me what basis we are subject to the local tiers and restrictions, and it's clear that alongside the data, there's other factors taken into account around these tier decisions. And I thank my right honourable friend for his response to the question for the honourable member for York Outer, that both the reasons and the data we published. Will local hospital bed utilisation be part of those reasons published?
Yes, there are 5 indicators that we take into account on deciding on which tier. One of them is pressure and anticipated pressure on the local NHS, where, of course, bed occupancy rates is a critical part of that assessment. I know that I know that people are looking for a clear numerical boundary between the different tiers, but because we're looking at 5 different indicators rather than a single one, there is no automatic figure at which a different tier is triggered. We've got to look at all circumstances, including, for instance, in terms of outbreaks, because there are some cities that on their pure numbers would be in tier 3, but because the outbreak is specific, for instance, in a school or care home, then it's appropriate that they're in tier 2. So you have to look at these very localized issues as well. That's why the engagement with local directors of public health is so important.
Sir Robert Sims.
There will be bitter disappointment in Dorset, both in the urban and rural area, that we're in tier 2, although our infection rates actually are now falling quite rapidly. So my main interest today is finding out how we get out of tier 2 into tier 1. If we're going to have regular reviews, i.e. weekly, that's great and that's fine. But if we're not, if we're stuck in that tier for 2 or 3 weeks, I wonder whether the Secretary of State would consider some kind of appeals process. And I wonder whether his Minister of State, the admirable member for Charnwood, might be the appeals process.
We work as a very cohesive team of ministers in the department, and we all work on COVID-related issues. I take the gentle chiding from my right honourable friend that he would rather my number 2 take these decisions, but I'm afraid he's stuck with me for the time being. Of course, on the serious point that he raises, we will review these in a fortnight and then regularly, by which he can reasonably take weekly. We have a weekly cycle of meetings with the Chief Medical Officer chairing a meeting on typically on a Tuesday. I then chair the meeting on a Wednesday for an announcement on Thursday for any change to the tiers.
Now we go to Swansea to Geraint Davis.
Madam Deputy Speaker, the Secretary of State knows I chair the all-party group on air pollution, so I won't be surprised that I point out that the tier 3 areas tend to be the areas of highest pollution, because for every microgram of PM 2.5 per cubic metre, that increases the COVID deaths by between 18 and 14%, and that's on top of the 40,000 deaths annually from air pollution. So would he agree with me that we need cross-government activity and an all-government report annually from DEFRA, from housing, from transport, on what they're doing individually and collectively to combat air pollution, and in so doing to reduce the COVID death rate and the overall death rate? I can see that the Prime Minister is nodding sagely. Would he agree with an annual report?
It's very impressive that he can see the Prime Minister since he's just left the chamber. But I'm sure the Prime Minister is nodding sagely wherever he is. The honourable gentleman makes a very serious point, and it's a very important point on which we agree, which is that air pollution is a serious health issue, and in lockdowns, air pollution has reduced. Now, that is one upside to what are otherwise very damaging things to have to do, but they are necessary to keep the virus under control. And I hope that we can continue to work together on tackling air pollution long after this pandemic's over.
Richard Graham.
Madam Deputy Speaker, for Gloucestershire in tier 2, next to South Gloucestershire in tier 3 and the Welsh border, can the Secretary of State confirm that there will be no travel restrictions between different tiers or across the Welsh border? And could he also, since the government can change tiers without debate, which has a huge impact, especially on the hospitality sector from tier 2 to 3. Would he also confirm when the date for the tier decisions will be published?
I'm afraid I can't confirm with respect to the Welsh border, because the restrictions on travel, the legal restrictions on travel, were a decision by the Welsh administration rather than by the UK government for England. We've taken the view that travel restrictions should be in guidance, because there's all sorts of complicated circumstances under which people might need to be might need to travel, and we've done that when we've been in national lockdown across England as well as locally. So I'm afraid I'm sorry that I can't be clearer than that. On the point about renewal and when we review these matters, we are proposing to review firstly on the 16th of December and then regularly thereafter to make sure that we keep the tiered restrictions as up to date as possible.
Now we go to Yvette Cooper.
Thank you, Madam Deputy Speaker. The Health Secretary will know the pressure that Pinderfields especially has been under. Staff have been doing an incredible job, and it is welcome that the number of COVID patients in hospital is starting to fall, and the number of infections locally has fallen by around 30% in the last week. But he will also know that our NHS, social care and public health staff have had a really difficult year, and the winter is going to carry on being tough with many operations to catch up on. So will he now look swiftly at the case for added support and pay for NHS, public health and social care staff this winter in recognition of the incredible job they have been doing to care for all of us?
Thank you very much, Madam Deputy Speaker. Well, I'm delighted that there's a significant increase in the number of NHS staff, and the figures published this morning show there's 14,800 more nurses than there was this time last year in the NHS. I'm really pleased about that. When she, and of course, yesterday she will have no doubt seen that the pause on pay increases across the public sector announced by my right honourable friend, the Chancellor, doesn't apply to nurses and doctors, and that is in part in recognition for the incredible work that they've done during this pandemic.
Jeremy Wright.
Thank you very much, Madam Deputy Speaker. As the economic damage the pandemic is doing becomes increasingly apparent, it's clearly right that businesses of all types are reopened as soon as it's safe to do so. Now, that's going to take longer than it needs to if the restrictions on those businesses are calculated on the basis of virus information for places a long way away, or as a geographical average for a wide area encompassing urban and rural parts. That's exactly what's going to happen to the businesses in my constituency, which will not be able to open if they are hospitality businesses next week, not because of the rates where they are, but the rates somewhere else. Surely it's more sensible to calculate restrictions on the smallest geographical area where data is reliable, that largely being boroughs and districts. Will my right honourable friend commit in his review in 2 weeks' time to look not just at whether individual areas are in the right tier, but whether the areas are properly constructed?
Yes, absolutely. My right honourable friend is absolutely right about the importance of this. We have to balance the need for an area to be the human geography in which people live, and be able to effectively communicate the tiering decisions across a geography with precisely the concern that he mentions. For instance, Slough is in tier 3, despite the fact that Berkshire, of which it is a part, is in tier 2. So we are prepared to take those decisions at a lower tier local authority area level. That is the exception rather than the norm, but we look at it every single week.
Now we go to Ayrshire, to Patricia Gibson.
Thank you, Madam Deputy Speaker. COVID-19 is a world pandemic, and so it needs to be tackled on a global basis. International travel will expose the UK to future outbreaks, particularly if the virus mutates. So on both humanitarian and public health grounds, does the Secretary of State not agree that it is indefensible to cut the international aid budget just as a global vaccine rollout begins?
Well, of course, we have been hugely supportive, and in fact, the UK is the biggest supporter internationally of providing vaccines in countries that wouldn't be able to afford them themselves. And I'm sure that that will continue because we will continue to have one of the largest international aid budgets in the world.
Peter Aldous.
Thank you very much, Madam Deputy Speaker. I know that my right honourable friend will thank everyone in both East and West Suffolk for getting down the level of infections, and that it is with a heavy heart that he has concluded that the county cannot exit Tier 1. Will he ensure that there are very clear indicators as to what else needs to be done so that Suffolk can move to Tier 1 as quickly as possible? And will he liaise with his right honourable friend, the Chancellor of the Exchequer, to put in place additional support for the very hard-hit hospitality sector?
Of course, I have constant discussions with the Chancellor of the Exchequer about the support that's needed, and my honourable friend is right to raise it, especially in Suffolk. And what I would say is that it is with a heavy heart that we took the decision on Suffolk. Its case rate is higher than the Isle of Wight and Cornwall, which are the two areas currently in Tier 1, but that does give an indication of where we need to get to, and I'm sure that if we all work together, then we'll be able to get there.
Emma Buck.
Thank you very much, Madam Deputy Speaker. We are stuck in an endless cycle of lockdowns that simply are not working. The government have again wasted the opportunity over the last few weeks to get a handle on testing, tracing and isolating. So once again, hospitality in South Shields is going to be absolutely battered and my constituents' liberty impacted on. Can the Secretary of State tell us exactly what is going to be different this time that will make our sacrifices yield a reduction in the infection rates?
Firstly, I would urge the Honourable Lady to look at the figures published this morning showing that the majority of tests are now, when done in person, are now turned around within 24 hours. Across the country, and capacity is radically increased. And what I'd ask of her for the future, and to help the North East get out of Tier 3, is to work with her local councils, with the Director of Public Health, to embrace the community testing that's been effective in Liverpool. And if they're up for doing that, and it has to be in consultation and in conjunction with the local council because they know the area, I very much hope that they'll come forward and pick up the baton and make that happen.
Now we go to Tewkesbury to Lawrence Robertson.
Thank you, Madam Deputy Speaker. This is not an easy question, but how can the Health Secretary take into account the wider mental and physical health implications for people who are prevented from living their lives as they would wish to live them?
Of course, we look as much as we can to take these impacts into account. For instance, the mental health of people under lockdown is, of course, more challenged than in normal circumstances. And we balance that both against the impact of COVID directly and also the impact of COVID filling up hospitals on the healthcare that we can all get for all the other conditions that exist. It is a difficult balance to strike. On the particular impact of mental health that he raised, the Royal College of Psychiatrists has been very interesting in terms of the work that they've done to understand the nuanced balance between the impact of COVID on people's mental health and the impact of lockdown on people's mental health. Both are significant, and I commend their work to him.
Now we go to Mary Glindon.
Thank you, Madam Deputy Speaker. And it's devastating that after all its efforts, the North East will be in Tier 3. But across the whole country, obesity remains a serious factor in COVID-19. And yesterday, the all-party group on obesity launched its report to build on the government's own obesity strategy. So will the Minister meet with officers of the group to discuss the report's recommendations and work with us to ensure a focus on the prevention and treatment of obesity in the fight against COVID-19.
Yes, she and I share an enthusiasm for this agenda, and we share our enthusiasm with the Prime Minister, who is a personal convert to the need to tackle obesity. And in fact, this crisis shows how important it is, because if you are obese, you are more likely to have a more serious impact of COVID if you catch it.
Rob Butler.
Thank you very much, Madam Deputy Speaker. We have consistently been told that we must accept restrictions to protect the NHS, and Bucks Healthcare Trust has done an amazing job in dealing with the pandemic from the very beginning. So can my right honourable friend therefore explain the weighting he puts on the pressures on the local NHS as one of the 5 indicators in the decision-making process over tiers? Because it would be very difficult indeed for people in Aylesbury to accept stringent controls on our lives and livelihoods if in fact there's plenty of capacity in hospitals for both COVID and non-COVID cases.
Well, we look at all 5 indicators essentially equally. But what I would say is that the pressure on the NHS, the point about pressure on the NHS, is a more sensitive indicator on the decision for going into tier 3, because if you're in the situation that Buckinghamshire is, for instance, where the case rate is elevated, but it's not as high as in many other parts of the country, the key thing to try to do is to keep that case rate where it is or lower. And we couldn't make the decision to put Buckinghamshire into tier 1, because if it goes up from where it is, then it won't be long until Buckinghamshire were in trouble. And therefore the decision to put it into tier 2, and I very much hope that cases can continue to go down until they're very low, like they are in Cornwall and on the Isle of Wight, for instance. And then we'll be able to review and consider tier 1. I hope that's a reasonable explanation. This is something that we need to continue to debate as we try to ensure that we get the judgments around these geographies exactly right.
Rachel Hopkins.
Thank you, Madam Deputy Speaker. The good people of Luton will want to get out of tier 2 as soon as possible, but the current resources provided to Luton Council for the lateral flow rapid testing pilot are insufficient to enable it to provide the level of mass testing that is being described nationally. The contained funding, £8 per person, just won't cover tests for 10% of Luton's population, as the funding also needs to be used for the wider COVID response, including wellbeing support for residents, for vulnerable residents. Can the Secretary of State confirm that there are national plans to provide additional support and resources to expand testing if the intention to test close contacts daily is pursued?
Yes, there'll be further funding for those areas that go into tier 2, and yet more funding for the areas that go into tier 3, to go to the councils for the extra support that's needed.
Christian Wakeford.
Thank you, Madam Deputy Speaker. I want to thank my right honourable friend, the Prime Minister, for the flexibility they're providing so that we can all have a family Christmas. However, I asked my right honourable friend what consideration have been given to Hanukkah starting in 2 weeks today regarding family gatherings and public menorah lightings, and if no flexibility is shown to the Jewish community, does he think this is fair?
We carefully considered this issue and consulted on it too, and discussed widely. The Christmas is a national holiday, as well as being very much a Christian celebration. That's reflected in the fact, for instance, that we have 2 days of bank holidays, and we consulted members of different faiths around precisely the question that my honourable friend rightly raises. And actually there was a strong degree of support for having something special in place for Christmas for everybody, even though we haven't been able to put that in place, whether for Hanukkah or indeed for other celebrations from other faiths.
Liz Twist.
Thank you, Madam Deputy Speaker. And can I start by assuring the Secretary of State that Directors of Public Health and local authorities in the LA7 area and the wider North East are certainly very focused on getting down that figure and have had some success. So I'd like to make that absolutely clear. The second point I'd like to make is that my constituents and others across the North East will be hugely disappointed to find that they're in Tier 3, particularly those businesses in hospitality and leisure, which are going to be so desperately hit by this. But the real point I want to make is about public health. Nothing has shown more than this pandemic that public health should be at the heart of what we do. We know that it affects outcomes in COVID-19, and we know that it affects health inequalities, affect the rate of transmission as well. So can the Secretary of State make sure that he impresses on the Chancellor and asks the Chancellor for more funding for public health services now and in the future?
Yes, I agree with every word of what the Honourable Lady said.
Bob Stewart.
Thank you very much, Madam Deputy Speaker. My constituency of Beckenham is very relieved to be in Tier 2. Very kind of you, Secretary of State. Can I ask, because I've had a couple of constituents ask me, whether they have to have a vaccination. I've said, no, they don't, as far as I know. But could I ask my right honourable friend whether he can tell the House what percentage of the population required to be vaccinated in order for the measures to be effective so we can get back to normal?
Thank you very much. I would urge everybody to get a vaccination if we manage to get a vaccine that is approved by the authorities, because the regulator will only approve a vaccine if it is safe and effective. But having said that, we are not planning to make it mandatory, because we hope that the vast majority of people will take it up, not least because it will help to protect them and to protect their community and get this whole country and indeed the world out of the mess that we're in.
Now we go to Barbara Keeley.
Thank you, Madam Deputy Speaker. The Winter Plan confirms the government will be taking action to restrict the movement of care staff between care homes. On the face of it, that's a perfectly sensible infection control measure. But many care staff are forced to work between multiple homes because of low hourly wages. Can the Secretary of State therefore give a commitment that care workers will suffer no loss of income as a result of this policy? And can he set out what he will do to ensure that no care staff actually lose any of their jobs because they're being forced to choose between the different homes they work in?
Well, I hope that we can, I hope that partly through this measure, also through the increase in the national living wage that the Chancellor confirmed yesterday, we can improve the pay and conditions of the staff across social care, because the proportion of people in social care who do work in a number of settings and work in agency and less secure work actually is, in my view, something that we should tackle together. And so I hope that we can use what is obviously put in place, as she quite rightly says, for public health infection control reasons, also to improve the standards of employment across social care, which is of course directly contracted by local authorities rather than by the central government, but nevertheless an area that I think we all know that we need to work to improve as a nation.
Dr. Julian Lewis.
Thank you, Madam Deputy Speaker. I'm sure my right honourable friend appreciates that many elderly people die with serious illnesses such as prostate cancer, but not from those illnesses. How certain is he that statistics showing the number of people dying with COVID-19 are not being presented or misinterpreted as people dying from COVID-19?
Well, the statistics on the number of people dying with COVID-19 is the best estimate that the statistics authorities, both in Public Health England and the Office for National Statistics, come up with. It is one of the widest definitions that countries use internationally, and therefore it does, as he implies in his question, include people who may have died of something else but with COVID. Nevertheless, each of these deaths we should work to avoid, And the best measure, according to the chief medical officer, is the total number of excess deaths compared to this time of year last year. And that is elevated now, and we need to get it down.
We go now to Leila Moran.
Thank you, Madam Deputy Speaker. May I first thank the Secretary of State for listening to local leaders who have been pushing for a one Oxfordshire approach to coronavirus as we go into Tier 2. I'm sure many residents understand the need to be careful for Christmas. Despite Oxfordshire's data being better than surrounding counties, we cannot risk any further damaging lockdowns. The reason we've done so well is superb team working in a county-wide systems approach involving all councils, the NHS and businesses. And in particular, we were quick off the mark to implement a locally test, trace and isolate system that is paying dividends. Does he agree that the key to beating this virus is to treat local areas as partners? And when they say they should be moving up and down tiers, that he will give their voice considerable weight?
Yes, I do give considerable weight to local leaders when they make a case for a particular tier for their area. And in her case, I'd like to pay tribute to Ian Hudspeth, who has worked incredibly hard during this crisis for the benefit of people right across Oxfordshire. I talk to him regularly about the situation in Oxfordshire, and Oxfordshire has made great strides in tackling this virus, including tackling the student outbreak at the university or universities in Oxford. I hope that they can work to get Oxfordshire appropriately down into Tier 1 as soon as possible, but there's some work still to do.
Anthony Higginbotham.
Thank you, Madam Deputy Speaker. Today's decision will be disappointing to businesses and residents across Burnley who have had extra restrictions on their lives and their businesses for longer than most. So could my right honourable friend set out exactly what support is going to go to Burnley and the wider Lancashire area, and when it will be delivered, so we can end these restrictions as soon as we possibly can?
Yes, Madam Deputy Speaker, Burnley has been in restrictions for a long time now and has brought its case rate down by about half since the peak in late September. My honourable friend has played a dutiful and impressive role in his public leadership within Burnley. I hope that we can work with Burnley Council, also with Lancashire County Council, to get the case rate down, to get Lancashire down into Tier 2, in the same way that Liverpool has managed to come down into Tier 2, a combination of people following the rules and that community testing. That is available to people in Lancashire. I very much hope to be able to work with the team in Burnley and across Lancashire to make this happen. And the final thing I'd say, Madam Deputy Speaker, is these are tough measures. I get that. I understand the impact on hospitality, but they are done for the right reasons, which is to keep people safe and to stop the local NHS being overwhelmed.
Charlotte Nichols.
Thank you, Madam Deputy Speaker. Warrington will be breathing a sigh of relief that we are emerging from national lockdown into Tier 2. But while I welcome the return of fans to stadia, I cannot support the extension of the substantial meal requirement to Tier 2, which will leave many pubs across my constituency closed. The pub sector faces an existential threat, and it flies in the face of logic and fairness that thousands can congregate at the rugby, but wet pubs that are the heart of our community must stay closed. Will he commit to publishing the specific evidence that underpinned the substantial meal requirement extension, and if he cannot, to removing this requirement?
Unfortunately, we will not be removing this requirement from Tier 2. It is incredibly important that we keep the cases under control. The local team in Warrington have worked very hard, along with the Liverpool City region, to get the case rate down. They went into national lockdown in Tier 3. They've come out in Tier 2. And the people of Warrington should be commended for that. But the measures of Tier 2 are necessary to keep the virus under control, because unfortunately, the virus thrives on when people get together. She mentioned the point about events in larger scale. They will only be done where there is very stringent social distancing. So there will not be congregations, as she said, of thousands of people. I'd like to reassure her of that, because these events will only take place when the capacity in normal times of any venue is much, much bigger than the number of people who are there.
Suzanne Webb.
Thank you, Madam Deputy Speaker. Firstly, I would like to thank the hard work and sacrifice made by residents in my constituency whose borough has been hard hit by the virus. With my constituency being in one of the worst affected areas, would my right honourable friend consider rolling out the vaccine as a priority when it is ready to the country's worst affected areas who have not only been blighted by this virus but hard hit economically? These are the areas that will be in much need of assistance to get back on their feet due to prolonged lockdown of the local economy, whilst also providing the much needed respite the vaccine will bring in these worst affected areas.
Madam Deputy Speaker, we've taken the decision to roll out the vaccine UK-wide at the same pace. I want to get it as soon as possible to the West Midlands and to everywhere else. But it is fair to the areas also that have had a low incidence of disease, or relatively low, to make sure they also have access to the vaccine. It also, the incidence in different parts of the country change, and this vaccine rollout program is very complicated. It doesn't actually speed up the delivery of the vaccine in one area to have slowed it down in another area, and that's why we've taken the UK-wide approach.
Nostro.
Madam Deputy Speaker, in keeping with my right honourable friend's spirit of working together, I stand not only to represent Wilden, but speak on behalf of my colleagues, the MP for Bexhill and Battle, the MP for Eastbourne and the MP for Hastings. We wish to collectively thank the CEOs of the CCG, ESH, our county leader Keith Glazier, and our local Department for Public Health for working with us day in, day out to understand the data and the reasons for the infection rates. So we are deeply disappointed that, considering all the 5 indicators where we mark extremely low, that we are in tier 2. And we are disappointed that central government has not consulted with these local leaders, because then they would have been able to investigate the data and hopefully show us how we can move into tier 1 into tier 2. Can I ask my right honourable friend to provide some assurances that these conversations will take place with local leaders, and also confirm that transparent, objective criteria will be published for each criteria, for each tier, forgive me, and also how we can slide between each tier as well. Thank you.
Yes, absolutely. I can give both of those assurances. Across Sussex, case rates are at 120. They do need to come down. I like her, I'd like to see Sussex get to tier 1 as soon as is possible. And we'll keep talking to the local area. As I said earlier, all directors of public health have been invited to discussions and consultations with the public health team, and that feedback fed into these decisions. But we've got to make sure those conversations continue. And the key message to everybody across Sussex and in the Wealden in particular is to, if we all stick together and if we all follow the rules, then we know that we can get this virus under control, and that will then lead directly to the lifting of restrictions, which we'll regularly review.
Now we go to Motherwell, to Marion Fellows.
Thank you, Madam Deputy Speaker. The Secretary of State will be aware of reports on the Oxford vaccine that the subgroup was suggested 90% effectiveness was due to a manufacturing error rather than being a planned protocol, included fewer than 3,000 people and did not have any participants over 55. Does he agree, therefore, that further research is required to verify the efficacy of the lower dose in all age groups before it can be adopted as a standard regimen?
Questions over the interpretation of the data in the clinical trials are rightly for the MHRA, who will assess these clinical trials, and they will only approve a vaccine for use if it is effective and safe.
Now we go to Colne Valley, to Jason McCartney.
Thank you, Madam Deputy Speaker. So the first review of Kirklees being in Tier 3 will be on the 16th of December. Will the Secretary of State for Health please confirm that his department will consult with local MPs, council leaders and the local Director of Public Health? Will he publish the full numerical criteria so that we know what we need to achieve to get out of Tier 3? Will the government support Kirklees in delivering mass testing? And finally, will he have a conversation with the Chancellor about delivering extra financial support for our hospitality businesses?
I will absolutely take up all of those suggestions. We are in discussions with Kirklees about what further we can do, including in the area of large-scale community testing and the other considerations that are necessary to make that happen.
And finally, we go to Upper Ban, to Carla Lockett.
Thank you, Madam Deputy Speaker. The Secretary of State is to be commended for his initiative that he and the Care Minister have spearheaded to allow close contact visits between relatives and residents in the care home setting. Will this proposed access vary depending on what tier a home is located in? And whilst I acknowledge this is a devolved issue, with little progress being made in this regard in Northern Ireland, will he undertake to share the experiences of his pilot with the Health Minister in Northern Ireland so that my constituents can also look to have these visits with loved ones as soon as possible?
Madam Deputy Speaker, subject to the results of the pilots which are ongoing, we hope in England to allow testing to allow for visiting in care homes before Christmas. I will absolutely have another conversation with my opposite number, Robin Swan, who is the Health Minister for Northern Ireland. Robin Swan is an excellent Health Minister. We work very closely together. I'm absolutely sure that together we will be able to make progress on testing and on other matters. He and I are in constant touch about how we can best serve the communities of Northern Ireland from the position of the UK government in our role in procuring tests around the world, and of course his vital role in keeping people safe right across the province.
I thank the Secretary of State. We have completed the statement. So in order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next item of business, I will suspend the House for 3 minutes. Order!